Depression is a complex mood disorder, but what if I told you that it's not how much you're sleeping, but how you're sleeping that's the key to overcoming your depression? By making just a few changes to your sleep patterns and routines, we think you can begin to make some meaningful changes and find better quality, more refreshing sleep. Depression, of course, looks different for different people, but many of the symptoms are the same.
Loss of interest in things that you like to do that you no longer have an interest in doing. Feelings of guilt about what you've done or what you failed to do. Decreased energy levels noted during the daytime. Problems with concentration. Dysregulation of appetite. That can be eating more or eating less.
But one of the primary things we see in depression is that sleep tends to be more complicated. For some of us, that means sleeping a lot, like 12 to 16 hours a day, but still feeling unrefreshed, still feeling sleepy throughout the day. For others, it could mean having more fragmented sleep, so that means you sleep in smaller chunks or struggle to fall asleep at all. Or maybe you wake up in the middle of the night and can't quite fall back asleep.
Depression and insomnia often walk hand in hand, and the insomnia may manifest as an early morning awakening. They go to bed at their normal bedtime, but they start waking too early, and then they can't easily get back to sleep. The sleep drive is diminished by morning, and so their ability to get back to sleep is low.
Either way, depression can really do a number on the overall quality and consistency of your sleep. But why is that? Well, throughout the night, a healthy sleep pattern cycles through each sleep stage at night. You enter stage 1 sleep, then stage 2, then into deep and REM sleep, then maybe back into stage 2. We call this rhythm your sleep architecture, and on average, each sleep cycle takes about 90 minutes to 2 hours. At the end of each sleep cycle, we drop into REM sleep, where about 20 to 25% of our night is usually spent. But what's interesting about people with depression is that the very architecture of their sleep changes, and specifically, it's the REM sleep that's affected. REM sleep is the sleep stage that kind of cleanses the brain. It flushes out metabolites that contribute to sleepiness and mood. And when we're depressed, well, that stage either gets shifted to earlier in your sleep cycle or maybe reduced overall.
What's fascinating is when we have somebody with major depression, their REM sleep, which usually never shows up until about maybe 80 or 90 minutes into the cycle, shows up very, very early. We're not exactly sure why this occurs, but it is a classic symptom of somebody who is having a major depressive episode. And in many cases, we can look at just the brain waves. We don't even have to talk to the patient, and we can see that that happens.
In fact, a study from 2013 concluded that REM sleep alterations may even come before the symptoms of depression, which is to say, you might not present with symptoms of depression during the day, but your sleep can actually be a biomarker of depression. And of course, the absence of consistent REM sleep leads to things like cognitive dysfunction, trouble concentrating, short-term memory issues, and ongoing mood issues. In other words, all the things your brain needs to be doing to help it function healthy and well, it's not doing. Now, often depression can be paired with another diagnosis, that is, anxiety. And trouble sleeping is a common complaint among people that suffer from both of these. But as Dr. Peters tells us, the very first step to finding improvement in your symptoms is working on your sleep.
You actually should be working to improve sleep first, and that both sleep and mood will improve if you can address an underlying sleep issue. If you focus all your efforts on improving mood and ignoring coexisting sleep issue, you won't make progress at either.
All right, well, this sounds good in theory, but how do you actually improve your sleep? Well, it's tempting to think that if we just get more sleep, then that will help with our depression. But research indicates that actually restricting your sleep offers some profound benefits for people suffering from depression.
For people with insomnia, we actually ask them to stay up later than they normally would. Let's say that you get in bed at 10 and you don't fall asleep until midnight, and then you get out of bed at 6. What I would say to you is, I don't want you going to bed until midnight. You're not falling asleep anyway, and all you're doing is lying there and getting upset. So why not use that time a little bit more productively and a little more wisely? Go to bed at midnight, get out of bed at 6, take no naps during the day, then you go to bed at midnight again. We're restricting the time in which you have the opportunity to sleep, usually to around 6 hours. Once we get an insomniac who can fall asleep during that time and stay asleep for that whole 6 hours, then I can start to slowly step them out a little bit more by keeping their wake-up time very consistent.
So the idea around sleep restriction is twofold. First, it's meant to increase your sleep drive by tapping into your natural desire to fall asleep and decrease the likelihood of awakenings. You want to make yourself as sleepy as possible.
It's very common for someone with depression to really extend their total sleep time and to have a lot of irregularity to bedtime, wake time, and napping routines. But one thing that can be helpful is to stabilize the patterns. So that might mean consistency in bedtime and wake time, just locking into a routine. Sometimes it's helpful to think back to a prior routine. Before I developed depression, when was my wake time? When did I set an alarm? What was my bedtime range? And try to get back to that routine.
By the way, there is a more extreme version of sleep restriction therapy out there. A study from 2021 looked at the effects of sleep deprivation as a treatment for depression. They found that sleep deprivation as a treatment for depression was, quote, superior to exercise in certain settings. And the study also concluded that the impact was, quote, significant but transient, which means it helped quite a bit, for a little while at least. Now, it's not a good idea to try sleep deprivation without consulting your physician first. But what should you do? Well, as Dr. Peters indicated, introducing some structure around your sleep is actually going to be really helpful. And what do I mean by structure? Well, as we said before, sticking to a regular bedtime and wake-up time, yes, even on the weekends, is incredibly important. We know that when you're depressed, it's difficult to even want to stick to a schedule. But really, it's gonna be one of the most important things you can do to help yourself get better sleep. Next, limit naps. Make sure you have a specific 7 to 9 hour window in which you give yourself an opportunity to sleep and stick to it. Then build in about an hour to wind down for sleep. This can include brushing your teeth and washing your face, meditating, reading, making a to-do list for tomorrow, even watching a little TV. But the point is, with a routine like this, you signal to your brain that it's time to sleep. And then throughout the day, be intentional about getting enough sunlight, physical activity, and social time. We know that when depression strikes, none of that sounds appealing. But these can give your mind and body a respite from some of those depressive spirals and force you to get outside of yourself. Now, if you're trying all of this and you're still not sleeping, there are 2 things to consider. First, see a sleep specialist to get a sleep study.
It might be a little bit of a chicken and an egg sometimes. Like there may be an underlying contributor, a sleep disorder like sleep apnea that's contributing to depression, also disturbing the system and how it would otherwise be working. It can be important to rule out other sleep disorders, and meeting with the primary care provider or a sleep provider may give some insight and guidance into what the underlying drivers are.
And then, see a therapist. We know the benefits are incredible, including for your sleep.
When people have depression and they go to therapy, they actually sleep better. Why? Because they're having the option to share some of these thoughts, get some feedback from somebody that they may not have been able to get, which allows them to accept their situation a little bit better.
Aside from therapy, really push yourself into setting a structure around your sleep that starts with establishing an effective bedtime routine. And we have a video all about that right here. Look, depression is a complex disorder that can interrupt your relationships, your daily life, and especially your sleep. Get outside, talk to your friends and family, set yourself a schedule, and you can at least find some ways to keep the darkness at bay. Thanks for watching, everyone. Sleep well.